next up, we are going to hear from one of our members from North Memorial. We have Dr. Cameron Berg, who is an emergency room physician and also on our MHA Chief Medical Informatics Officers group. And he is here to along with a company called GeaCom, which is a Minnesota-based company based out of Duluth that has a very unique technology solution for hospitals and health systems to be able to do a large number of different things that I'll let them explain. But we have Dr. Berg, and then we also have the CEO from GeaCom, Matt Johnson, and Katya Crespin, who is the general manager. So Dr. Berg, take it away.
Thanks so much, Joe, and good morning to everyone. As Joe mentioned, my name is Cameron Berg. I'm very proud to be joining you here. I'm one of the emergency doctors at North Memorial, and I also help with our informatics program on the inpatient side. And so I just wanted to give a moment of some opening comments about our relationship with GeaCom, and then some initial reflections and testimonial about our experience with this platform, in particular during the pandemic. And so to set the stage, I just want to say that we've been engaged with GeaCom for a number of years, going back and forth, iterating on what I think you'll learn more about here in a few moments is a really cool platform. So it's called this Fraser Kitsune platform. It's tablet-based, medical device, and it allows you to do some really customized workflows, which is what we were most excited about for this over the years. So we had worked with them developing kind of a cockpit style technology, and we were really looking at front of the house on emergency department intake cases and trying to solve for what I think many of you are familiar with, which is there's a lot of idle time in conventional inpatient-patient encounters. They come in and we have lots of discrete touch points with them where we do things like register them and triage them and populate various components of the EHR. But I think, as everybody knows, care in the hospital kind of goes through these little chunks of fits and starts. And a lot of what we try to do is match the acuity of the customers with the capacity of the system. So what we were excited about with the Fraser Kitsune platform was that we could try to take advantage of that downtime in the customer experience. So you all can think of many times when this occurs, right? It happens after you walk in and you get registered and then you're shown to a chair. Or it might happen when you're waiting for your labs to come back. Or it might happen when you're waiting for, room service to deliver the next meal. And so with this platform, we had the ability to serve the customer different pieces of content. And so some of that content might be things that we want in the EHR. Can you help us do your home med rec, right? That would be great. And other things were things that the customer might want, like, can I, have a soothing meditation, a guided meditation? So the platform could do both of those things, and that's pretty uncommon in healthcare technology. So that was the stage that we had set, and we were actually, in 2019, we were working with GeaCom on some informed consent workflows, another area that's really challenging, where we wanted to take advantage. One of the key features of this system is it can deliver content in a culturally relevant way. So at North Memorial, we have lots of customers that come to us and English is not their native language. And so we have communication challenges, and especially when it comes to procedural informed consent, it seems like getting communication right matters a lot. And so we had been working with some language specific informed consent, and then COVID came. And so I want to take you back just about exactly 2 years ago, and especially in the emergency department, we were scared. And there was a scarcity in supply, and we knew that we had to iterate really quickly on new workflows. And you all remember this, right? It was all technology all the time. It was how can we convert everything possible to telehealth? It was how can we bring in lots of new screens to the hospital to keep our teams safe and keep delivering excellent patient care. And that was not easy. Tablets were not available. Computers were not available. There were supply chain challenges. You couldn't get vendor support for any of this stuff. And really the core piece of this testimonial is like, this is a good company in Minnesota that you can talk to. And so in, near real time, within a matter of days, they had, a dozen of these tablets in our hands. And we turned on technology assisted video visits within the walls of the hospital, on week one. And that was something we couldn't have done, I think, with a lot of the other vendor relationships that we had. So we've used them throughout the pandemic to keep our teams safe, and it's been, great. It's only scratching the surface of what this platform can do, because we're basically using it as a, glorified two-way video communication device, and it's awesome for that. So to close with just these comments, it's a really modular platform that I think will allow you to do many things. I gave you just some glimpses of the areas that we've explored in the past. And I think some of that, the customizability and then the relationship you could have with a Minnesota-based company has, in our experience, been a differentiator.
Great. Thanks, Dr. Berg. I'm going to turn it over to Matt Johnson, the CEO of GeaCom, and Katya as well.
Well, thanks, Cameron. So, Cameron touched on a lot of things that I think are relevant. We are a Minnesota-based company. We make this engagement platform to FDA standards, 100% antimicrobial, antifungal. But what we learned from the market and folks like Cameron are really how to streamline this for your immediate needs, how to do a better job of not only managing the patient variable, but the cockpit that Cameron helped us co-develop gives the ability for your staff to have a force multiplier. So you can have one staff member effectively managing several patients where in the past it was just a one-to-one relationship. Initiating engagements for those patients that help them share their, triage, past medical history, social history, medication reconciliation, having 4 and 5 patients working with one staff provider to effectively go directly from this platform to the chart with no scribe, with no translator, and to be able to do it securely, safely, meeting infectious disease control. And really, I think the thing that Cameron touched on that's important that fits your workflows. It's not, here's this thing that you need to change everything to work with. No, here is an excellent tool set that provides you safe, effective, FDA-grade engagement solutions. It's a system beyond just the thing the patient holds. It's a system that gives staff deeper insight. Who's in our waiting room right now? It's not a waiting room. It's a Fraser engagement room. They're progressing their care. Exactly where are they in their care stream? Where do I want to send them next? A single person can navigate and direct patients in different directions, regardless if they speak English or not, if they're literate or not, and it can really give them this real ability to have a force multiplier without diminishing the care of that patient, without having that patient feel isolated or alone in that process, which is really, a lot of a patient's experience is waiting, alone, anxiety. At any point in time, as a patient is going through sharing their information directly to the record, a staff member can enter into a conversation in real time with that patient. Hey, you're doing a great job of sharing your information. We have a room. We're going to have you see the doctor very soon, right? And that's a game changer. So patients, for the first time on this technology, are never alone. As soon as they enter the doors of your facility, that is their door-to-doctor time. That is their time to connect to your staff. They're not alone. And if they're a different language, they're not isolated. They're working with somebody on the platform who looks like them. And equity has become such a huge challenge in the market space. But it's not just a challenge of saying, well, people are fed up with feeling like they're not being treated equal. It's a challenge of people really work well with someone they can relate to, someone who matches their culture, their race, their language, their background. And so they begin to share more relevant, more accurate information more comfortably. And it builds a relationship with their providers so that they have that preparedness when the provider is in face-to-face contact with them. And so I think that's one of the features that we've really been able to co-develop with market input, with the help from North Memorial and Cameron in particular. And, we're not going to be able to demonstrate the cockpit and everything in a short introduction like this. But I think the thing to say is that we are an innovator who has available solutions that really address the challenges that you're facing today, from patient flow to staff limitations to creating better safety inside of your facility, and ultimately to be able to take control of your workflows. Katya, do you have anything to add?
Yeah, maybe just one quick addition. I know we touched on the emergency department as one of the use cases. It's important to understand that the platform can be employed in any area of care. So mental health, inpatient, outpatient, primary care, ED, urgent care, inpatient. So the room, there's no defined use case where you have to start, but the recommendation is usually to start in an emergency care setting, because in that scenario, you never know who walks into your door, and you have a way to really harmonize that patient engagement with the platform and take it from there.
So I guess a nice way to put it would be whether it's a scheduled appointment or it's an emergency appointment. When a patient enters into your service, you can welcome them to your facility, pull up their record quickly, and then begin those engagements to help get them roomed. So welcome to our facility. Let's get started. You're now connected to your care team. As soon as the patient takes this into their hands, physicians and providers and nurses will see them enter into the cockpit. And where they are, new patient has entered in, patient begins sharing their information. As a patient works through the interfaces on the device, it is actually, without reading and writing, helping them author the chart, carefully getting information from them automatically, and helping the staff see exactly where they're at. If there's an alert about a patient being depressed or having severe pain, that alert will appear in the cockpit. The LEDs will light up, and that patient will navigate from the registration desk to the room, having provided full information necessary for proper rooming and being prepared for that physician encounter. From that point, as Cameron had mentioned, there's in fully informed consent can take a physician 20-25 minutes sometimes. With Fraser, we can reduce that time down to just a couple of minutes in many cases. And that fully informed consent is provided, and the physician can focus on those areas where the patient has specific concerns or questions. The patient continues to navigate through care, gets an examination, spends some time with the physician, and then this helps discharge them. So if the physician says, look, this is great, I have a care plan for you, I'm going to have the labs back, and then Fraser will help get you discharged. And that helps that patient flow through more effectively and more quickly and never feel like they're being disregarded or left isolated in the process. And again, when it involves someone who doesn't speak English, who has low literacy, it's a real powerful tool to say, if this patient's Arabic, or if this patient's English, or if this patient's Somali, I can predictively know from registration desk to being ready to be roomed, it's going to be, about 12 minutes, depending on how you set up your workflows. But you will know that there's not a variant. And that's incredibly powerful for process improvement, very powerful for efficiency, better staff utilization. And another feature that, we've been able to bring up over the last couple of years is the ability for providers and nurses who are not on site to participate with the patients when there's heavier flow. So it's a load balancing technique. Say, well, we anticipated registration staff of 4 people. We have more patients than we anticipated. Let's have someone off-site help us bring those patients into service. Let's have someone off-site help with those patients who have, additional needs. And it's a way to effectively use your staffing even when they're not on site or at a different location in your facility.
But hey, we truly appreciate the two of you and bringing this innovation to our members and to this conference. Matt and Katya, thank you so much. And Cameron, it was fantastic seeing you again. Thank you for your continued leadership.